Hello and welcome to Blood and Cancer Clinic for Children, Kanakia Healthcare. A diagnosis of cancer is the hardest thing that a family can face. And if it involves a child, it is even more difficult. As a Pediatric Hematologist-Oncologist for the past 25 years in the city of Mumbai, I have been asked some questions every day, over and over again. In this video, I'm going to take you through those questions. Most parents tell me we didn't even know that children could get cancer. So are you sure it's a cancer? So yes, cancer does happen in children, unfortunately. And there are specific different types of cancers. The commonest being the leukemia, brain tumors, liver cancers like hepatoblastoma, kidney tumors like Wilms tumor, neuroblastoma, and the other rarer cancers. The very next question the parents ask me is, we don't have a history of cancer in the family. None of our friends or anybody has even heard of this kind of a thing. So how did my child get it? So it's not necessary for a child to have a family history of cancer. That means it's not necessary that some other family member should or would have cancer. If they do have it, then it is called as the cancer predisposition syndromes. That means there are certain diseases which predispose a family or a child to cancer. In addition, I would say that most of these cancers are spontaneous, means they've just happened by themselves. The other most painful question is that why did my child get it, doctor? So we really don't have an answer to that, but let us try and understand what is cancer. Our body is made up of millions of cells. There are different types of cells in different organs of the body performing different functions. And all these are tightly regulated or tightly controlled by genes. These genes help in cell division as well as in the eventual destruction and death of the cells. So if these genes are mutated, let us put it like a biological accident. In that case, this entire tight regulation is lost and the cells either keep dividing continuously or otherwise they fail to die on time, giving rise to what is called as a tumor or a mass in different parts of the body. But if it happens in the bone marrow, these cells tend to crowd out or they tend to push out the normal cells in the bone marrow, the ones which make blood. Doctor, did we do something wrong? Could we have prevented this? So as we say that this is a biological accident, there is really nothing much you can do to prevent it, except maybe avoid secondhand smoking or maybe ionizing radiations or certain drugs, etc. But there is really not much that a parent can do to prevent a cancer in the child. So to sum it up, let me say that there is nothing that you could have done or nothing that you should have done. This was just by chance. And now, everybody has seen movies, everybody has read stories about somebody having cancer and the suffering. So it is very natural for them to ask, for parents to ask, will my child be able to tolerate chemotherapy? He's so small or she's so little. The good part about it is that children are very resilient, they are very strong and they are able to withstand chemotherapy much better than adults. In addition to that, we have very good medicines. So for example, if you are worried about the child having vomiting, we have excellent anti-emetic drugs which we give before chemotherapy, during chemotherapy and after chemotherapy as well, and the child is pretty comfortable. The other question is, will the child lose hair? The children generally do lose hair because chemotherapy affects the most actively dividing cells of the body, and the hair follicles are one of those cells. So yes, there will be hair fall or hair loss, but it will 100% come back, sometimes even better. What should we give the child now? The important thing is to maintain excellent hygiene, to maintain hand washing, give the child homemade food, and try and increase the calorie content of every serving, because the child may not be able to eat more. So it is basically reverse of dieting. Please boil the water and check with your doctor whether the child should or would be able to have fresh fruits and vegetables at this point in time. What about school? So if the child is very young, we say that it's all right. A couple of months here or there is not going to make such a big difference. But if the child is a little older, we've had children giving exams, carrying their books to the ward and studying while during their chemotherapy. Should we disclose the diagnosis to him or her? So we feel that it is safer to explain to the child in an age-appropriate manner the diagnosis as well as the outcome of the disease, because children these days are very technology savvy and they will Google things on their own. If not, they will ask their friends, and their friends will have way lesser understanding of either the disease or the outcome. Yet another worry which all parents have is the financial problems and the financial affordability of treatment. Now the thing is that in India, we have hospitals which kind of address all kinds of patients. For the weaker sections of society, there are different government schemes such as Rajiv Gandhi Yojana and others. Even in corporate hospitals, if the child has a yellow or an orange ration card, in that case also they are eligible for a lot of discounts and even free treatment. In addition to this, there are a lot of organizations in the city of Mumbai which are more than happy to help children and families who are affected with cancer. And the final and the recent thing which is now available is crowdfunding. So what are the papers that are generally required? It's the PAN card, Aadhaar card, the ration card, a letter from the Tehsildar at times, as well as the family income certificate is what is generally required at most. These were some of the commonest questions that I get asked on a daily basis. I'm sure you have many more in your mind. Please put them in the comment section below and I will try and answer them. Or you could talk to your doctor and get all your doubts cleared. Also, if you feel that there is somebody who can benefit from this video, please do share it with them. Subscribe to this channel for more such videos and for more information. Please remember, this is not a substitute for a consultation with your doctor, and you have to be in touch with them at all times. Thank you so much for watching. I am Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai.